Rich, it's a very exciting day on Intolerant Cooks. We have a visitor, Dr. Jason Tye-Din. You are a complete expert on everything we cover on this show.
Oh, thank you, Karen. Thanks for having me too, Richard.
You're welcome.
Well, I guess, look, I look after a lot of people with coeliac disease, but irritable bowel syndrome and low FODMAP diets are also an important part of what I do.
Jason, I'd really like to ask you the difference between someone who is celiac and someone who is gluten intolerant.
Yeah, well, it's a really important question. We know about 10% of Australians at least are going wheat-free or gluten-free. And in most of those cases, it's because they're feeling unwell, that they're getting tummy upset, bloating, constipation, diarrhoea, or sometimes they have just poor concentration or feeling lethargic. And so they go on a gluten-free diet or wheat-free diet and they feel better. But the problem there is that we now know that there's a subset of people who probably have undiagnosed celiac disease, and that's a really important medical autoimmune condition. And we used to think celiac disease was just a bit of a gut issue. You know, you get a bit bloated after eating wheat or pasta. But no, it's far more than that. We now know it's an autoimmune disease and it can present with a whole range of issues. And people who don't follow a gluten-free diet can be at higher risk of infertility or osteoporosis or even pregnancy loss. But those people who don't have celiac disease, what we're finding now, even though they're calling themselves gluten sensitive, in many cases it's actually not gluten that's making them sick. And we're finding the research is showing that there's other weak components that may be triggering their symptoms. And so it's really important to start with getting tested and getting a proper diagnosis to direct where you go with things.
What's an easy resource for people wanting to test themselves for celiac disease?
Well, one easy way is if people go to the website celiac.org.au/assess. And what we have there is an online assessment tool that people can fill out the symptoms or the problems that they're getting, and it'll generate a letter that they can take to their doctor, and that can help start the conversation. And many of my patients just feel so much better because it validates their years of symptoms that have been often dismissed in the past.
I spent years feeling unwell, and it's not until I got fully tested for everything and I felt really cared for, and then I began that slow road forward, and it was fantastic for me.
Yeah, it's all about improving your health and quality of life and trying to focus in on what you really need in your diet. Again, balance and variety is really what you need. Yeah.
A little bit of everything is the spice of life.